here today for another conversation relating to COVID-19. Today, we're going to be talking to Dr. Carroll, who's a professor in our Department of Pathology here at Hopkins. She's also the director of the Division of Medical Microbiology in the Department of Pathology. And since March, Karen and her team have just done an outstanding job helping us with COVID testing here at Hopkins. So, Karen, thanks for talking with me today.
You're very welcome. Thank you for the invitation.
Oh, it's good to see you. So tell us how you guys started to develop a test here, which was, I'll just stay up front, was really important for our response to COVID.
Our molecular diagnostic laboratory under the direction of Dr. Heba Mustafa, they just went into high gear. So we went live with that test, as you know, on March 11th. After 1 week of validation. So the lab just did an amazing job. Normally it would take much longer than that, but we had wonderful molecular technologists working around the clock. We went live. Our throughput, as you might recall, was only about 50 tests per day. But soon, with the assistance of Dr. Goki's lab, Dr. Goki is the director of our molecular pathology lab. He and Dr. Mustafa and all of the technologists in the two laboratories were able to get us up to a volume of about 500 per day. So that was good. However, the lab developed test was quite labor intensive and was not really amenable to scaling up beyond the 500 per day. So we needed a higher throughput platform in order to get us to that benchmark. We reached out again to pathology administration and to the hospital administration to help us buy an alternative high throughput platform called the pneumatics. That instrument now has become the workhorse, and it was such a great instrument that we bought a second one. So that's how we were able to actually scale up to the 1,000 to 1,200 per day, where we are now.
How many tests have you done total, Karen?
So we just crossed the 70,000.
70,000.
70,000.
And what's our percent positivity out of all those? Do you have?
So, it's sort of a rolling positivity. We started at our peak around 25% positivity. Wow. We're now down to about 11.5%.
Wow.
So, yeah.
That's amazing. And how many tests are you doing a day right now?
Right. So right now it ranges anywhere from 800 to 1,100.
Tell us some of the other things we've done in terms of how we expanded that testing. You talked about now in our ambulatory, all surgeries get tested, all admissions get tested, but a little bit of how we reached out to the community have been helping the city and the state with testing.
Yeah, so we were fortunate because we had a test early on that was relatively high throughput, even when we were doing the manual lab developed test, to be able to help the other hospitals in the city when their allocation of supplies didn't meet their demand. And so I would say in total, we have assisted 9 other hospitals in the greater Baltimore area, and actually 1 hospital in southern Pennsylvania, in York, Pennsylvania. And most of them were very reasonable. They basically said, can you take 10 to 20? This would really help us. We only have enough, we don't have enough to cover our ICUs and our EDs, and patients are beginning to stack up, and, we may have to close our emergency department. And so we were really happy to be able to step in and provide that overflow testing, so to speak. And we are still doing that for some of the hospitals. The other group that, really deserves a big shout out is the Hopkins Go team. And this is the group, I know the nursing home testing was led by Dr. Morgan Katz. this group went out into nursing homes and did sample collection throughout Baltimore City, and also, I believe, assisted with testing for 3 of the homeless shelters. I think the GO team has thus far collected over 3,000 samples from the nursing home and homeless shelter groups. And then more recently, Baltimore City and the Maryland State Department of Health approached Johns Hopkins about assisting with some of the community outreach. So we have Hopkins clinicians reaching out to some of the communities where the individuals have not been able to get to a testing center, or for whatever other reasons are concerned about that. So we are taking testing into the community.
How many are we going to be doing in 6 months from now? What's the capacity to grow the ability to do the testing?
Yes. So our goal is to try to get up to make sure that we have enough reagents to do 2,000 a day. I think some of that has been driven by the desire to have testing for the undergraduate campus when students may return to campus. There may be some limited testing performed for initially on some of those students who choose to come back. Also, I think we have to be concerned about what's going to happen in the fall when respiratory season starts. Because then when someone presents with a respiratory syndrome, we have to answer the question, is this influenza? Is it another type of respiratory virus? Or is it, SARS-CoV-2? So what we are going to see, hopefully, fingers crossed, many of the companies that are making the SARS-CoV-2 test are now also working on a combination influenza SARS test, so that we, instead of having to test separately, we can test for the main respiratory viruses during flu season. So we're likely to see testing go up regardless of whether it's just SARS alone or SARS plus influenza.
Karen, I want to take this opportunity to thank you, head of the whole lab, and the entire Department of Pathology, because both the antibody test and the multiple RT-PCR tests for the virus that you have developed and have run, I think have not only served the institution well, but served our patients well. And now the truth is, you're reaching out across the city and state. You're really doing a great service to all communities, which is really important. So I wanted to take this opportunity to ensure that you and your team are thanked for everything you've been doing for us. So
thank you very much. I will pass that along to my team.
Thank you.
Very nice. Very nice. Thank you. And thank you for the opportunity to chat with you.
Well, thanks for spending the time with us today.